Hello class, welcome to our virtual activity on how to use the micropipette for molecular procedures. So in this video, you will learn the proper pipetting techniques appropriate for the solution that you will be using. So we have here micropipettes on a rack with different set of volume ranges. We have the 2UL micropipette, the 1000 UL micropipette, the 200 UL micropipette, and lastly, the 20 UL micropipette. Now take note that different micropipette brands slightly vary on their volume ranges. Also, we have two pressable parts in this type of micropipette, the plunger and the ejector button. Most brands have actually manufactured the plunger as the adjustment knob as well. So in setting the desired volume of the micropipette for a particular procedure, just gently rotate the knob, and at the front of the pipette, you can see the volume indicator. So next, it is important to know the difference between the first stop and the second stop, as this will determine the piping technique you are performing. The first stop is the first resistance you feel when pressing the plunger. Pressing it down further, that is the second stop. To insert the pipette tip to the micropipette, just gently insert the end of the shaft onto the pipette tip and push it down lightly. Do not touch nor assist it with your hands. Now to remove it, just press the ejector button and discard the tip onto an appropriate infectious waste. When performing the actual pipetting, it is best to select the smallest volume micropipette that will transfer the volume. Set the adjustment knob first to its desired volume before inserting the pipette tip. After that, you can then proceed with the appropriate pipetting technique, which is generally there are two types, the forward and the reverse. For the forward technique, press the plunger until the first stop and aspirate the solution by gently releasing the plunger. Always do pre-wetting of the pipette tip before aspirating. Then dispense the solution by gently pressing the plunger up until the second stop. Forward technique is appropriate for aqueous solution. For the reverse technique, you aspirate by gently pressing the plunger until the second stop and slowly release to aspirate. Again, pre-wet your tip before fully aspirating the solution. To dispense it, press the plunger until the first stop only. The reverse technique is actually appropriate only for viscous and foamy solutions. That ends our video. Thank you for watching.